Good morning, everyone. Good morning, viewers at home and around the world. We are happy to be back this morning on Health Matter on WAP TV. Okay, as usual, with me today is slimmest of them all.
Yeah,
With a very
doctor.
lovely hairdo. I like your appearance this
Thank
morning.
you, doctor. Thank you.
Yeah.
Good
You're
morning,
welcome
sir.
to the show.
Yeah, good to have you.
Chifo, good morning, sir.
Hey,
So good to have you.
Good to see you too.
Yeah, thank
What
you
of
very
the
much.
family and the
Happy.
We are
patients?
doing very well.
I know.
Yeah. So once again, I welcome all of you back to the show. My name's Dr. Bartholomew Tochukwu Febunam. I'm the medical director of Grace Valley Medical Center here in Lagos. This morning, by virtue of the WHO calendar, World Health Organization calendar, we'll be looking at another new topic. We do know that every second Thursday of every March, which happens to be 14th of March, this year is World Kidney Day.
World Kidney
And the
Day.
theme of this year's World Kidney Day is kidney health for everyone, everywhere. Kidney health for everyone, everywhere. And as we always do, later in the program, hopefully by next week, we're going to bring in a consultant nephrologist who's going to be with us to do justice to the topic. Okay? So, but this morning, we are starting with the introduction of the topic. Okay, so by way of introduction, we are going to start with definition of what kidney is all about, the location of the kidney in the human body, the anatomy of the kidney, the functions of the kidney, before we can go over to the challenges that we can have with the kidney. Talking about acute renal failure, also known as acute kidney injury, as well as CKD. But this morning, we'll be concentrating on acute kidney injury, otherwise known as acute renal failure or acute kidney failure, if you like. All of them are the same thing, okay? So by way of introduction, we want to talk about the structures of the kidney as well as the location. Now, the kidney is a pair of organs, a bean-shaped organ. We have a picture on our screen, okay, located on either side of the spine at the lower border of the rib cage in the human body. Most people usually will have two kidneys, okay, but it has also been reported that there are some few persons that may have just a single kidney, and with that single kidney, they will still be able to lead a normal life. And sometimes they may not even know that they have a single kidney. Usually, they are discovered more or less through an accidental finding, okay? So, kidneys, the structures of the kidney. The kidney, usually, the dimension of an adult kidney is about 10 cm long, 6 cm wide, and 4 cm thick. And it weighs between 150 to 170 grams. That's for an adult kidney. And like we said at the beginning, there are usually two. More accessible from the back. If you put your hand just the way I've positioned my hand, they're much closer to the back than the front. Okay? Now, these two kidneys, kidney is a major organ in the human body because of the importance of the kidney, because of the function it observes. The major function of the kidney, one of the primary functions of the kidney, is to take care of the waste that are generated in our bodies. One author described it as a very sophisticated trash collector. A very sophisticated trash collector in the human body.
Can we also, is that the same thing as metabolism?
No, metabolism is just
they fight against.
No, metabolism is just the activities that go on in the human body. Okay? So we'll come to that. Now, one of the things, first, let's go back to the anatomy of the kidney. I've mentioned the dimensions, 10 cm long, 6 cm wide as well as 4 cm thick. Now, these kidneys on either side of the body have a tubular connection that connects it to the bladder. Now, that tubular connection that connects it to the bladder is actually what we refer to as ureters. Okay? They are hollow-shaped tubes that convey urine that are produced on the two kidneys down to the bladder. And the length of these ureters are usually 25 cm. And of course, the bladder is at the lower, lower abdominal area, as you can see on the screen before us. Usually, the capacity of the bladder, when it is almost filled, is between 400 to 500 mils. Also, it would be nice to point out that each of the kidneys contain nephrons. Each of them contain about 1 million nephrons. These nephrons are actually the ones that play a role in most of the metabolism that go on in the kidneys, as we can see before us in the picture that are being displayed at the moment. Now, this nebus, this nephron, I beg your pardon, this nephron contains it consists majorly of the glomerulus, when there are more than one glomeruli, as well as tubules. On one side of it, on the left side, you can see the glomerulus, okay? And towards the right, you can see the tubules. There are a set of blood vessels within the glomerulus that are intertwined with tiny, tiny tubes that conduct, through which urine are usually filtered, okay, into the tubules. Permit me to also say that a whole lot of processes actually go on in this nephron. For instance, the exchange, the quantity of blood that flows into every minute, about 1,200 ml of blood flows into the glomerulus or the glomeruli. Okay. And this is said to be this represents about 20% of the blood volume that are usually pumped per minute by the heart. Okay, so in a 24-hour period, the quantity of blood that will be pouring into the glomeruli is about 1,700 liters. That's a large number of a large quantity of blood. Now, to make it, to bring it closer home in a way everybody can understand, a liter, 1 liter is about let me use the common things that we know around us. A sachet of pure water is about 500 mils. So if you have 2 sachets of pure water combined, you have 1 liter. Okay, that is to say that if we are talking about 1,700 liters, we are talking about 3,400 sachets of pure water. That is the quantity of blood that gushes into the kidney, the blood that it filters over a space of 24 hours. And that is quite large. Yeah. Now, it is through these exchanges that waste products are taken out of the blood or of the body, of the human body, and then passed down as urine with other components. Okay, but I need to point out some of the processes that actually take place in this glomeruli, some of the exchanges. The quantity of urine that gets into, I'm talking about urine now, the quantity of urine that gets into the glomeruli in a space of, over a space of 24 hours is about 180 liters. 180 liters of fluid, actually urine, actually filtered through this set of glomeruli, which we said that each kidney contains about 1 million. So for the 2 kidneys, you have about 2 million that are working at the same time. And then what happens is that When the filtration goes on, about 180 liters of urine would have gone through it. It is not all of this urine that the body ends up excreting. Okay, so there is a second missionary journey kind of a process that happens after the first one. It is called reabsorption. Now, what happens in the reabsorption is that usually in the course of the filtration, a lot of solid components, chemicals, will be equally sieved. Waste, as well as some other important one, glucose, compounds like phosphorus, chlorides, and some other electrolytes, as well as some other, as well as protein too, will be sieved. But because they are macromolecules, they are big molecules, they will not be able to be filtered. So a normal kidney actually cannot filter all of these things. So it's abnormal for you to find protein in anybody's urine. Because ordinarily, if the kidneys are functioning the way they should function, the macromolecules, the big molecules, they can actually not be able to pass through the tiny holes or openings that are contained in this glomeruli. Okay, so during the reabsorption, some of the components that the body that are still useful for the human body will be reabsorbed. As a matter of fact, it's being said that only about 2 liters of urine, 1 to 2 liters of urine will be done away with at the end of the day, will be excreted at the end of the day. So we're talking about having about
168.
No.
170 something.
Oh, yes, so, it said 180. About 178 will be reabsorbed at the end of the day. So what will be filtered out will just be about 1 to 2 mils. Okay? 1 to 2, not 1 to 2 mils, 1 to 2 liters. Okay? Approximately about 4 sachets of pure water is what the human body will excrete through urine at the end of the day. Okay? Now, but there are some disease conditions that usually when they come up, when they begin to affect the substance of the kidney, this filtration system, the integrity of this filtration system is lost or is compromised, in the sense that components that ideally shouldn't have passed through the tiny pores will now begin to pass. And that is what happens when somebody is pushing out protein in urine. When a patient who has a kidney problem is presenting with protein in urine, which we usually refer as proteinuria, or sometimes glucose in urine, which we refer to as glucosuria. We'll come to all that. Now, going back to the major functions of the kidney, apart from serving as a conduit pipe that filters waste, as well as ensures that the waste products leave the human system, the kidney too does the function of controlling the body, the fluid level in the body. It takes care of the excess water in the human body, regulates as well as take away the excess water in the human body. It also involves in production of a number of hormones that do a lot of functions in the human body. The renin that helps in the control of blood pressure, the aldosterone, the prostaglandins, the erythropoietin that participate in the production of red blood cells are some of the important hormones that are produced in the kidney.
Is it also responsible for the conversion of glucose to glycogen, sir?
That happens in the liver. Okay. Thank you very much for that question. You're a very good student, sir. Okay. So other functions that the kidney perform in the human body, apart from it also partake in maintaining the exchanges. Usually, the active form of vitamin D, which helps to balance the uptake of calcium with phosphorus in the body, is produced in the kidney. So if you have challenges where kidney functions are compromised, you discover that such a person will start losing calcium unnecessarily. The bones will become brittle and can easily fracture. Okay? So it also helps to maintain the integrity of not just the bone, but as well as the teeth. Okay? So other than taking care of waste, maintaining blood fluid in the body, making sure that there's no excess water in the human body, it actually performs some of these functions that we have mentioned. And this morning, we're going to lay emphasis on acute kidney injury, otherwise known as acute renal failure or acute kidney failure. They all mean the same thing. In case we mention AKI, we are talking about the same thing. Now, what usually happens is that you could have an acute kidney injury and you could have a chronic kidney disease, otherwise known as CKD. Okay? For acute kidney injury, for acute renal failure, the onset is usually within hours to days. Okay? And some of the things that can cause it, we're going to talk about them regionally.
Okay.
Number one of the major causes for acute kidney injury are problems that can affect the blood supply to the kidneys. We're going to mention a whole lot of problems under that. Okay, we have something displayed on our screen. Number 2 is problems that affect the substance of the kidney itself. So we have what we refer to as the problem that affect the supply of blood to the kidney, that compromise the supply of blood to the kidney, are called the pre-renal causes. Okay? While the ones that affect the substance of the kidney are called the renal causes. There are also problems that can affect the outflow of urine from the kidney. Okay? That is the number 3 group of causes. And are called the post-renal causes of acute kidney failure or acute kidney injury. So we'll go back to the first one. Problems that can compromise blood supply to the kidney, the pre-renal causes now.
Sure.
Number 1 is severe dehydration. Severe dehydration. Severe dehydration can occur as a result of severe diarrhea.
Can we call that loss of water, sir?
Of course, you're correct, sir. Severe diarrhea in a situation where somebody may be stooling and vomiting, and he has done that several episodes without getting a replenishment, that can easily cause acute renal failure or acute kidney injury. Permit me to also point out that most of the time, the people who suffer acute kidney injuries are people who are hospitalized, especially people who are in ICU, because at that stage, their system are already going through challenges. Okay? Other things that can cause acute kidney injury is bleeding, hemorrhage, which could be as a result of anything. It could be in as a case of labor, where a woman probably delivered and probably started bleeding. It could also be as a result of physical loss that can happen in a situation where one is involved in road traffic accidents. Okay? Sometimes too, women who have heavy menstrual bleeding, menorrhagia. Some women bleed from beginning of the month to end of the month. Any cause at all, any major cause at all that can affect
too much of blood.
Yes, that involves loss of blood. Okay? That can predispose such a person to that. Also, drugs, prolonged use of drugs, over-the-counter drugs, like ibuprofen, naproxen, and aspirin, can actually cause this problem. Not just when one takes this drug one-off, also for some few days. Okay, but we usually have people who oftentimes they've developed the habit
of taking it.
Not just taking. They will take much more than is prescribed, even on the pack.
Overdose.
Okay, I have seen some in situations where some people who say they have headache,
and then they'll be like, they can't take the regular
the normal
dose.
paracetamol, the usual dose of 2 tablets,
Say it doesn't work anymore.
Yes.
that it doesn't
3,
work for
4.
them.
Yeah.
And they will take as much as 6.
500 milligram per each.
It is dangerous. Okay? So you shouldn't be your own doctor. And of course, you know, some of these drugs are not prescription-only drugs. They are OTC, over-the-counter drug. Anybody can buy it from anywhere. Okay? So at that stage, you're almost your own doctor. So you need to be careful. Okay? If you have been doing that.
Stop.
Okay? Now, other causes too that can cause that can cause shortage of blood to the kidney. Okay? Among those causes too are some form of cancers. Okay? Some form of cancer treatment, in which case, or some imaging investigations that involve the use of contrast dyes, okay, or contrast studies that can actually predispose one to an acute kidney injury or acute kidney failure. Okay? Now, still on the causes now, we'll go over to the renal causes.
Yes.
Among the renal causes, you could have a direct trauma to the kidney. Okay? I think at this stage, it would be nice for us to open the phone lines. The numbers to call are displayed on our screen. I'm sure Slimity will want to mention them for those of you who cannot see from where you're seated.
Okay, just everything, Doctor, in case you know if you see the numbers, 081-7314-758 and of course 081-054-34984. Just help us reduce the volume. I know I see the try call us this morning because I know see 1,001 persons will get questions relating to waiting with the treat today on the show. So, Doctor,
Thank you very much. So, let me go back so that I can actually mention some of the things I may have left out. Still on the causes that have to do with shortage of reduction of blood flow to the kidney. You have things like heart disease or heart attack, liver failure, infections, use of non-steroidal anti-inflammatory drugs. I've given some examples, such as aspirin, ibuprofen, and naproxen. In situations where people have or somebody suffers a serious burns injury, okay, that can also happen, as well as severe allergic reaction. All of these will cause reduction of blood supply to the kidney, and these are some of the ones we can see under pre-renal causes, okay? Under renal causes, there are some diseases that affects the kidney, the substance of the kidney. A good example is glomerulonephritis, okay, as well as SLE, systemic lupus erythematosus. There's also other things that can affect the renal causes now include street drugs, okay? So people who are in the habit of abusing drugs as well as alcohol, you are endangering your kidney, okay? Blood clots too can be found among these causes. Blood clots in and around the kidneys, okay? The use of antibiotics, excessive use of antibiotics. Sometimes a doctor prescribes an antibiotic to you and you go home only for you to continue on the antibiotics till the kingdom come. The doctor may have asked you to take the antibiotic for a period of, say, 7 days to 10 days, but you're continuing till the kingdom come. That is pure drug abuse, okay? Whatever you do along that line, you should know that you're exposing your system to some other dangers that can affect your kidney. Now, we'll go over to the post-renal causes, the ones that affect, that actually cause blockage of the urine that are coming out of the kidneys, okay? Now, some form of cancers in that region of the body can compromise or obstruct the outflow of urine, okay? Kidney stones too can actually cause blockage along that line.
Talk about kidney stones, what do you mean?
Just asking.
Because I remember growing up, they were advised not to take seeds of guava. When you want to eat it, they'll tell you, okay, no, don't eat that. Does it affect? Is that what you mean by kidney stones? Or they are debts? They are accumulated debts?
No, they are not. That is not the seeds of guava that we are referring to here. But it's a very good question.
I'm just asking. Don't laugh at my question.
No.
Let's take Zainab. Let's take Zainab first. Zainab,
good morning. Zainab from Zamfara.
Good morning.
Yeah,
how are you doing?
I'm fine.
Yes, do you have a question for us?
Question.
Please, it's based on what the doctor was saying. I have a question to ask.
Yes,
I
go ahead.
really enjoy the course.
Okay.
Thank you.
Thank you. Very cool.
About some having feeling pain in bladder. What normally causes?
She was responsible.
Yes.
For pain in the bladder.
What is responsible for pains in someone's bladder?
Yeah.
Okay, thank you very much. Is that all the question? Do you have another
Do you
question?
have any other one?
Yeah, and at times I used to feel pain by my left side.
Okay.
And several times I visit a doctor, but they told me that's nothing. So
The left side, is it lower down or the upper side of the left?
it's the lower down of the left side.
Okay, and of course you're a woman. It could be as a result of many. We have a number of differentials.
Yeah.
Thank you very much for your question, Zainab.
Welcome.
Zaina.
Okay, so I will start with the first one. What causes pains in the human bladder?
Sorry, sir. Before you answer that, I think that's the same with what I want to. Does this stone we are talking about have anything to do with? Is it called gallbladder? Just ask.
No, it's not called gallbladder, but there are gallbladder stones as well. Okay, so one of the causes, one of the answers to Zainab's question is the stone that you have talked about. Okay, in medicine we call it calculi. Okay, if it is in the kidney, we call it renal calculi. Okay, the stones too can be responsible for pains in the bladder. To answer her question, as well as that of Zainab, what causes the formation of this stone? The stones are formed from compounds in the body that usually, oftentimes, some compounds in the body, some elements, some compounds in the body will crystallize out, forming little, tiny droplets, which oftentimes will come together to form much bigger stone. So more or less is a product from the body, from some of the compounds in the human body that usually come and then aggregate together to form stones.
Okay.
And sometimes they could become bigger. By the time they get matted together, they could become bigger. We have Mark from Adamawa. Mark, good morning.
Doctor, good morning.
Good morning, my brother. How is Adamawa today?
Adamawa is doing very fine.
Okay.
Yeah. Please, I have a question to ask.
Go ahead, sir.
Hello?
Yes, just lower lower your TV volume and go ahead.
It's all right. I've done that.
Yeah.
My question is lack of drinking of water. Can it cause kidney problems?
Lack of what?
Lack of drinking water. I mean, not drinking
When
water.
you're not taking enough water.
water.
Okay, thank you very much.
Yeah, and I also have another question.
Go ahead.
If we like somebody is holding urine for a long time, somebody is holding urine for a long time without urinating, can it also cause a problem?
Yes. Let me start from the first one.
Yes.
Okay. Now, his question, the second question he asks is, if someone retains urine for a long time, can it cause a problem? I will come to that. The first one was lack of water. When one does not take enough water, can it predispose one to any problem, to kidney problem? Not exactly if you don't take enough water, but in a situation where you are dehydrated, it could be as a result of fasting, starvation. It could be as a result of passage of watery stool, diarrhea. Anything that can involve loss of water without adequate replacement. Anything that can predispose anybody to dehydration, when it becomes severe, it can affect the kidney, and it can be one of the causes of acute kidney injury. But it's usually reversible when the underlying factor has been taken care of. Okay? Now, his second question was, if one retains urine for a long time, will it pose any problem? Yes, it can cause acute urinary retention. Sometimes when you retain urine for a long time, probably as a result of traveling, you're in a long journey, you don't want to ask the driver to stop. You could get to your destination and now go to pee. You discover that you'll be unable to pee anymore. So you can get acute urinary retention, okay? But not in all the cases, but that can happen, okay? Returning urine too can actually give rise, because some of these waste products that the kidney filters out of the body that are meant to be pushed out of the body, by the time you return urine for a long time, it will actually produce an enabling environment for the formation of the stones that we are talking about. Okay? But you could also have the stones in the kidney. You can have it in the bladder. You can have it in the gallbladder, like he mentioned, okay? In which case we refer to them as cholelithiasis, when you have gallbladder stones, okay? Sometimes they could cause problem in the gallbladder. They could cause inflammation as well as infection, which we refer to as cholecystitis, okay? So, but the stones can be in the kidney, it can be in the gallbladder, it can be in the bladder as well. And in any of these places, it can be a cause for pain. So what we usually advise is for people to drink enough water, plenty of water.
Okay, but doctor,
it helps to push out some of these stones.
Okay, what is the advantage of the water we take in the morning? Because most times we are advised to take water first thing in the morning before you eat. What does that does that help the kidney in any form?
Thank you very much. It helps in a number of ways. If you've been observant, anytime you wake up and you take plenty of water, one of the things that you realize is that you go and pee.
Yes,
not too long after that.
Yes.
Okay, and also it also helps one to open his or her bowel. You discover that you'll be able to go to the toilet and easily pass out your excreta and you're getting ready for work. It has a number of advantages. Okay. So water itself, we usually say that water is life. Yes. So if you develop the habit of taking water, usually in the morning, it helps and it has a number of health benefits. In fact, there can never be too much if you're able to take, if you'll be able to take whatever volume your system can allow you to take. Okay, but make sure that what you're taking is not water that is
too much of everything.
No, I'm not talking about too much. Make sure that what you're taking is water that, not contaminated water. That water that is clean enough. I don't want to use the word pure water. It will mean something else.
Okay. So vis-a-vis this question now, something actually came to my mind when you talk about holding urine. We have a caller?
Yes.
Okay, Royal.
From Delta State. Good morning, Royal.
Good morning, doctor.
Good morning, sir.
Yeah. Okay, my question is, I found out that most of the time, if I eat something like bread or anything that will make me not go to the toilet, I have a pain at the lower side of the right hand side. That's my abdomen, the lower side. So I try as much as not to eat bread, but I don't know the consequence.
Okay. It tries to stay away from bread.
No. What side? The right or the left?
The right.
The right, sir?
Yes, the lower part.
Okay. Now, if as a man, you're having pains on the right side, lower abdomen, we'll refer to it as the right iliac fossa area. This area that I'm touching, if you're having pains there, there are needs for you to go and see your doctor. Of course, it could be an acute appendicitis that you're having. So you need to be evaluated in a hospital setting so that the doctor can actually find out. But it may not be so for a woman because of the organs that are usually located in that same region. If that were to be a woman, in which case you have the womb there, you have the bladder as well as the ovaries, you could have a number of differentials. Just like a while ago, the question, the person that called from Zamfara that was talking about having pains in the left side of her lower abdomen. In her own case, because she's a woman, it could be as a result of, number one, the pain may have something to do with her ovary on the left side. Don't forget, we have two ovaries, one on either side of the body, the right and the left. It could be an ovarian cyst. Okay? It could be an ovarian torsion, but that will not, the picture she painted may not be that of ovarian torsion because it comes with very severe pain that will actually get the person to the hospital. Okay? But for a man, if he's on the right side, we need to rule out appendix, an inflamed appendix. So I beseech you to go and see your doctor so that you can be properly examined. If need be to, you can be sent for an abdominal ultrasound. Thank you very much, sir.
Okay,
Thank
sir.
you.
Yeah.
Like I was saying, the issue of that scholar that asked that holding urine and causing kidney problem. I want to remember that once upon a time, an expert on this set told us that ability to hold urine is a good test. It's a test that your kidney is in good form. Because one of the problems of kidney failure is that you won't be able to hold urine. So most times I try to see, let me hold this urine to see my urine.
I don't think that was the picture he painted. I think
like
you misunderstood him.
Yes.
That wasn't the picture he painted. You misunderstood him. Okay, because what happens when you have chronic kidney disease, you have a change. One of the presenting symptoms that you have a change in urinary habit. Okay, the volume may be reduced. Okay, lower down it used to be, or it can be increased. Okay, now it's different set of things that actually responsible for that. Okay, but not that he encourages us to hold our urine. No.
I thought maybe it's a form of exercising the kidney.
No, what happens is that sometimes in a hospital setting, when somebody probably goes after having the urethral catheter passed for someone who probably went to have a surgery, when the person is discharged, usually the catheter may stay for in most cases it will stay for 24 hours to 48 hours, it will be removed. But if it is someone like a woman who had a CS and probably had a bladder injury, the catheter can stay for as much as 10 days so that it will allow for the bladder to heal properly before it will be removed. Before that, bladder will be subjected to work again. Don't forget, it's just a tubular structure like a balloon. Okay, so the more urine gets, the more it expands. Yeah. Okay, so in such a situation, we could ask such a person to do what we refer to as bladder training. Because after removing the catheter, they will start bedwetting. Adults. The person goes home only to start to discover that he or she cannot hold urine anymore like she used to do. Okay? Recently, I have a man who after being catheterized in the hospital, was discharged and he has been experiencing that. So for such people, we ask them to do bladder training. Okay, what that means is that he gets to the loo, he gets to the toilet, and he wants to pee. He begins to pee. After a while, he holds the urine back. He tries to hold it back again with force and then start peeing again. Hold it back again with force and start peeing again. When you do it repeatedly, that can help to restore the sphincteric tone. That's the integrity of the muscles that usually control the urination in such a person. Okay, but other than that, I don't think anybody will advise you to keep holding your urine. Okay.
The very next question I want to ask might sound very
no, feel free.
Might sound very cheap, but I've observed that whenever people have kidney problems, it comes with a swollen tummy.
We are going to that now.
Good. So because I've had a sibling who had that. So I want to ask, does every swollen tummy in sickness...
Swollen legs, not just the stomach. I think
but the stomach is always
outside
protrude.
Yes, the legs are always very swollen.
Yes. So this takes us, thank you for that question. Thank you too. This takes us back to symptoms of acute kidney injury. Okay? Number one, we have talked about reduction in urinary output, not enough urine. Okay? You could have swelling, just like you rightly mentioned a while ago, on the legs, on the ankles, or feet. Sometimes the swelling could be what we refer to as, it could be pitting. When you press your hand, it creates a depression. If you press your hand and hold it momentarily and then take it off, it creates a depression on the leg. We call that pitting pedal edema. Okay? You could also have shortness of breath.
Really?
Okay? You can have you can have weakness, lethargy. You can have nausea. You can have pain on the chest. You can also have abdominal distension. Okay? What usually happens is that when we were talking about the functions of the kidney, we have Uche from Enugu. Uche, good morning.
Good morning, Uche.
Hello?
Yeah, hello, good morning.
Hello, doctor, good morning.
Yeah, good morning, my brother.
I want to ask a question.
Go ahead.
Please, does taking decaffeinated coffee have anything to do to the kidney? That's the question.
Thank you very much
for that question.
As it affects a lot of persons.
Honestly, I was very honest with you. I have not made findings on that, okay? But my promise is that we'll have a nephrologist in the house, hopefully by next week, okay? I will personally ask him that question. So let's see what somebody who's an authority in the field will have to tell us.
I think he's a coffee specialist. For him to calculate and decalculate.
I want to have a question, okay, for the nephrologist who will be joining us next week by the grace of God, okay? So he will be able to do justice to the question. Thank you for calling in. Okay, so other signs and symptoms that you could have in someone who has a kidney problem is facial puffiness. They come with swollen face, okay? Sometimes they could have eye bags. We call them periorbital halo. They could have eye bags. Now, this facial puffiness usually is discovered in the morning when the person wakes up. Okay, but as the day goes on, they tend to clear. Okay, now if you're having challenges like that, if you're having reduction in urine output, you should be thinking. Sometimes it could occur with generalized
sweating. When you don't sweat, it's a problem. So.
Depending on the degree
not
of
the
your
weather.
Okay. But it's difficult to say why. It's difficult to actually say that one is not sweating as a result of this or that, because oftentimes it could be as a result of the weather. Don't forget, if we're in a cold weather, the perspiration seems to be
as
you
osmosis
urinate
and diffusion.
More and
yes.
I know, you urinate more.
My Enos, you're doing very well.
Doctor, we are following. It's not based that we are coming here
Quickly, sir. The issue of urinating excessively overnight, is it also a symptom?
Yes, it's a symptom.
Excessive urinating.
Yeah, excessive urination is a symptom. How fast time flies.
When we're having interesting
topics like this. But anyways, doctor, I think this is, like you said, we are likely to have
there is a big topic. We are still going to go into CKD, chronic kidney disease. So viewers at home, thank you for hooking up. We'll continue from where we are stopping today next week. I'm from Slimmy T.
Thank you. See you guys.
And Chief himself.
I love my fast.
Bye-bye.